Imagine sitting in a dimly lit examination room, watching the soft glow of an ultrasound screen, trusting that modern medicine sees everything. The technology is advanced, the machines are precise, and the specialists are highly trained. Yet sometimes, something extraordinary hides in plain sight. Even in an era of high-resolution imaging and digital accuracy, life can remain undetected. There have been cases where what appeared to be a shadow, a mass, or even a suspected tumor turned out to be something far more astonishing. A second heartbeat, a hidden presence, a twin concealed within the womb, invisible to the very machines designed to reveal it. How can this happen in the 21st century? How can something so alive be mistaken for something so wrong? Today, we're diving deep into the science behind so-called invisible twins on ultrasound and exploring how such extraordinary diagnostic surprises can occur. This is not a story about superstition or outdated equipment. It is about biology, physics, probability, and the remarkable complexity of human development. We will uncover how fetal positioning, technological limitations, human interpretation, and rare medical phenomena can combine to conceal a perfectly healthy baby in what doctors sometimes initially interpret as an abnormal mass. And in some cases, physicians truly believed they were looking at a tumor, only to later discover a thriving child hidden in plain sight. If you're fascinated by the mysteries of pregnancy and the limits of modern medicine, make sure to like this video, subscribe to the channel, and stay with us until the end. The science behind invisible twins on ultrasound begins with understanding how ultrasound technology actually works. Ultrasound imaging relies on high-frequency sound waves that travel through the body and reflect back when they encounter tissues of different densities. These echoes are translated into visual images on a screen, creating what appears to be a clear window into the womb. However, this window is not perfect. The clarity of the image depends on many variables, including the angle of the probe, the position of the fetus, the amount of amniotic fluid, maternal body composition, and even subtle differences in tissue density. When two fetuses are present, especially in early pregnancy, one may physically obscure the other. If a twin is positioned directly behind its sibling, pressed against the uterine wall, or hidden in a corner of the gestational sac, the returning sound waves may overlap in a way that makes one baby nearly indistinguishable from surrounding tissue, leading to incomplete visualization. Early gestation adds another layer of complexity to this phenomenon. During the first trimester, embryos are extremely small, and their structures are still forming. Ultrasound resolution at this stage, although impressive, has limits. When twins develop very close together, particularly in monochorionic pregnancies where they share a placenta, the separation between them may be subtle and difficult to distinguish. A hidden twin can appear as a shadow or blend seamlessly into placental tissue. In rare cases, if one embryo implants slightly later than the other, a phenomenon sometimes referred to as superfetation in extreme theoretical scenarios, size discrepancies can further complicate detection. A significantly smaller twin may be overlooked entirely during a routine scan focused on confirming viability. The physician may document a single healthy fetus, unaware that another life is developing in a concealed position, shielded by anatomy and the physics of sound wave reflection. Fetal positioning plays a crucial role in diagnostic accuracy. The uterus is not an open, evenly lit chamber but a dynamic, three-dimensional environment. Babies move, curl, stretch, and rotate. If one twin consistently positions itself behind the other, especially along the same axis as the ultrasound beam, it may be masked. The concept is similar to trying to see two objects perfectly aligned from a single viewpoint. The front object blocks the one behind it. In addition, maternal anatomical factors such as a retroverted uterus or the presence of uterine fibroids can alter imaging angles. These conditions can create acoustic shadows or distortions that further reduce clarity. Even experienced sonographers rely heavily on optimal angles and cooperative fetal movement to obtain clear images. When those conditions are not ideal, a second fetus can remain effectively invisible, not because it is absent, but because the pathway of sound waves fails to isolate it distinctly. Another scientific explanation involves the interpretation of ambiguous images. Ultrasound does not produce photographs but rather grayscale representations of sound wave echoes. The human brain must interpret patterns of light and shadow to identify anatomical structures. When two structures overlap, the composite image can be misleading. In some documented cases, what was initially thought to be a mass or abnormal growth was later identified as a second gestational sac or fetal body part. The distinction between tumor tissue and fetal tissue can sometimes be subtle in early scans, particularly if the hidden twin is positioned atypically or if the pregnancy is still in a very early developmental stage. Radiologists and obstetricians are trained to recognize patterns, but pattern recognition depends on probability. Since single pregnancies are statistically more common, ambiguous shapes may initially be interpreted through that lens, contributing to rare but dramatic surprises. Technological limitations, despite rapid advancements, also contribute to these diagnostic challenges. Modern ultrasound machines offer higher resolution and even three-dimensional imaging, yet they are still constrained by physics. Sound waves can scatter, attenuate, or be absorbed by tissues in unpredictable ways. In patients with higher body mass index, for example, increased adipose tissue can reduce image sharpness. Similarly, low amniotic fluid levels decrease the acoustic contrast needed to outline fetal structures clearly. When contrast is poor, small anatomical differences blur together. A twin pressed against the placenta may appear as a thickened placental region rather than a separate entity. Even 3D imaging, while helpful, relies on data gathered from multiple 2D slices, meaning that if the original slices fail to capture the hidden twin distinctly, the reconstructed image may still miss it. Human factors must also be considered. Sonography is both a technical and interpretive skill. The operator must choose angles, adjust depth, control gain settings, and decide when an image is sufficiently clear. In busy clinical settings, routine scans may be brief and focus primarily on confirming heartbeat and measuring growth. If a second fetus is not immediately apparent, additional extensive scanning might not be performed, especially in early pregnancy. Confirmation bias can subtly influence perception. Once a single fetus is identified with a strong heartbeat, attention may shift toward measuring that baby's development. The assumption of singularity becomes reinforced with each subsequent scan, unless clear evidence suggests otherwise. This does not imply negligence but rather illustrates how cognitive shortcuts, essential for efficiency, can occasionally contribute to rare oversights in highly complex biological scenarios. In some extraordinary cases, doctors believed they were observing a tumor rather than a hidden twin. This startling twist often occurs when the concealed fetus presents as an irregular mass without immediately recognizable features such as limbs or a clear heartbeat. If the twin is positioned in a way that limits visible movement or if the imaging angle fails to capture cardiac activity clearly, the structure may appear suspicious. Differential diagnosis in pregnancy can include ovarian cysts, fibroids, molar tissue, or other masses. When a second gestational sac is compressed or partially obscured, its outline may resemble abnormal tissue growth. Further imaging, additional weeks of development, or alternative scanning techniques often clarify the situation, transforming what was once feared as pathology into the joyful revelation of a healthy baby previously hidden from view. Biological diversity in twin pregnancies further complicates detection. Twins can be dizygotic, originating from two separate eggs, or monozygotic, resulting from the splitting of a single fertilized egg. The timing of that split determines placental structure and sac arrangement. In monochorionic monoamniotic twins, where both share the same placenta and amniotic sac, distinguishing between two fetuses can be particularly challenging in early stages. The absence of a dividing membrane eliminates a clear visual separator. Movements may appear synchronized or overlapping, making it difficult to differentiate individual bodies. If one twin is consistently positioned posteriorly closer to the uterine wall, its features may blend into background tissue. Only as growth progresses and spatial separation increases does the second presence become unmistakably clear, sometimes leading to a dramatic mid-pregnancy discovery. The concept of vanishing twin syndrome also intersects with this topic, though in reverse fashion. In vanishing twin cases, two embryos are initially present, but one ceases to develop and is reabsorbed. This phenomenon is relatively common and can create confusion in early imaging. However, the existence of this syndrome may also influence clinical expectations. When ambiguity appears in early scans, physicians may anticipate loss rather than concealment. The assumption that one embryo has failed to thrive may shape interpretation of unclear images. Yet occasionally, what appears to be diminishing tissue may simply be a hidden fetus whose position prevents full visualization. Distinguishing between reabsorption and concealment requires time, follow-up scans, and careful evaluation of growth patterns, reinforcing the importance of longitudinal observation in obstetric care. Acoustic shadowing is another important technical factor. When sound waves encounter dense structures such as bone, they are either reflected strongly or blocked, casting a shadow behind them. In twin pregnancies, if one fetus is developing, bones intercept the ultrasound beam. They can create an acoustic shadow that obscures the second fetus. This phenomenon is particularly relevant as skeletal structures become more defined. The shadow may appear as a darkened area on the screen, within which details are lost. If the hidden twin resides primarily within this acoustic shadow, it may remain undetected during certain angles of scanning. Only by adjusting probe position or waiting for fetal movement can the sonographer circumvent this limitation. Without those adjustments, the concealed twin may remain invisible during routine examinations. Placental placement also influences visibility. An anterior placenta positioned along the front wall of the uterus can act as an additional barrier between the ultrasound probe and the fetuses. If one twin implants closer to this placental region, the increased tissue thickness can reduce clarity. The placenta itself has a heterogeneous texture, and a small fetus nestled against it may blend visually. In early gestation, when fetal proportions are small relative to placental mass, differentiation becomes even more challenging. Moreover, in cases where twins share vascular connections, placental thickness may appear irregular, further complicating interpretation. What might initially resemble an abnormal placental growth could later reveal the contours of a developing baby as gestation advances and size differences become more pronounced. Timing of prenatal care plays a subtle yet meaningful role. In pregnancies where the first ultrasound occurs relatively late, a hidden twin may have had sufficient time to grow into clearer visibility. Conversely, very early scans performed primarily to confirm pregnancy may miss a second embryo that is still too small or positioned unfavorably. Follow-up schedules vary depending on medical guidelines and individual circumstances. If symptoms do not suggest complications, additional early imaging may not be deemed necessary. As a result, the second twin might only be discovered during a routine mid-trimester anatomy scan, surprising both parents and clinicians. This delayed revelation underscores how diagnostic certainty often depends on repeated observation over time rather than a single snapshot. Psychological impact on families can be profound when an invisible twin is finally revealed. The transition from expecting one child to preparing for two transforms practical planning, emotional expectations, and financial considerations. Yet from a scientific standpoint, the discovery reflects not failure but the inherent complexity of imaging living systems. Medicine operates within probabilities and constraints. Even the most advanced diagnostic tools are interpretations of physical signals filtered through biological variability. The hidden twin phenomenon serves as a reminder that human development does not always conform neatly to technological assumptions. Each pregnancy unfolds within a unique anatomical landscape, shaped by genetics, implantation patterns, and dynamic growth. Ethically, these cases reinforce the importance of cautious communication in medical settings. When uncertain findings appear on ultrasound, clinicians must balance transparency with measured interpretation. Prematurely labeling an ambiguous structure as a tumor can create anxiety, while dismissing it entirely may delay necessary follow-up. The rare scenario in which a suspected mass turns out to be a healthy baby illustrates the necessity of differential diagnosis and careful monitoring. Medicine advances not by claiming infallibility but by acknowledging uncertainty and refining methods. Each unexpected twin discovery contributes to a broader understanding of how imaging can mislead and how vigilance can correct those initial impressions. From a broader scientific perspective, invisible twins highlight the intersection between technology and biology. Ultrasound translates vibrations into images, yet life inside the womb remains three-dimensional, fluid, and constantly changing. No static frame can fully capture that complexity. As imaging technologies continue to evolve, incorporating higher frequencies, improved software algorithms, and artificial intelligence-assisted interpretation, detection rates will likely improve. Still, absolute certainty may remain elusive. Biological systems resist perfect predictability. The hidden twin is not a myth or miracle, but a testament to the intricate choreography of fetal development and the interpretive nature of medical imaging. Ultimately, the phenomenon reveals both the power and the limitations of modern diagnostics. It demonstrates that even in highly controlled clinical environments, surprises can emerge. A shadow once feared as pathology can become a symbol of resilience and life. The science behind invisible twins is grounded in acoustics, embryology, anatomy, and cognition. It is a story not of error alone but of complexity. When doctors believed they were seeing a tumor, they were responding logically to the data available at that moment. When that data evolved, so did the diagnosis. Within that evolution lies the remarkable truth. Sometimes, hidden within uncertainty, there is not danger, but another heartbeat waiting to be seen. The story of invisible twins challenges our belief that technology sees all and reminds us that life can still surprise even the most advanced systems. It reveals that science is not about perfection, but about continuous refinement and humility in the face of complexity. Within the quiet shadows of an ultrasound image, something extraordinary can remain hidden, not because it does not exist, but because perspective, physics, and probability momentarily obscure it. In those rare moments when a feared tumor becomes a thriving baby, we are reminded that uncertainty is not always a sign of danger. Sometimes, it is simply a reminder that life is more intricate than we imagine, unfolding beyond the limits of our screens and expectations.